Today we are going to talk about rotator cuff and how we can accelerate the healing during the surgery. So, hello everyone, I am Dr. Aditya Sai. Welcome to our channel of the Shoulder and Knee Clinic, where we discuss various issues regarding the shoulder, the knee, the new innovations about shoulder surgery, and so on. So, let's just refresh about your rotator cuff. So essentially a group of muscles around your shoulder which help in moving your shoulder, which stabilize your shoulder, is the rotator cuff. And it can get injured by a variety of ways like injuries, trauma, or it can be a degenerative tear of the rotator cuff. Unfortunately, a torn rotator cuff doesn't heal on itself, and we need to consider arthroscopic surgery or keyhole surgeries to repair the rotator cuff. So this has been there since quite some time. Arthroscopy, essentially, since it's a minimally invasive surgery, it is done through small cuts around your shoulder about the size of your fingernail, and typically you can be discharged the same day or the next day of the procedure. Now, where things have got interesting is nowadays we are doing various techniques to augment the healing of the rotator cuff so that you have a more complete result and a faster recovery. So, starting from the basic and going to the more advanced, let's see what all we can do. So one is using a double row repair or a linked double row repair. Essentially, there are two varieties of rotator cuff repairs. One is a single row repair where only the medial row of anchor is tied and the rotator cuff is sutured with that. It is a good technique. The only downside is there can be more gapping in the rotator cuff tissue post surgery, and we need to be slow with starting the rehabilitation. The second technique is a linked double row repair where two sets of anchors are used, one in the medial row and one in the lateral row. It gives a good compression to the footprint over the tuberosity so that better healing happens. It has shown lesser gapping compared to a single row repair and good results. Now, when we do this repair, the type of anchors also matter. So we nowadays use hollow anchors which allow for more bone marrow egress during the surgery and post surgery, which helps with the healing. The second thing which we do is something known as a crimson duvet. So essentially, we clean up the tuberosity or the bone in the area where we are planning to do the rotator cuff. We create small bone marrow vents in that area so that the bone marrow comes out and aids in the healing of the rotator cuff. So these two are the very basic biological things which we do. Now, in addition to that, we can sometimes give bone marrow injection over a repaired rotator cuff or PRP injections to accelerate the healing process. Now, the next step is using the biceps tendon. So, as you recall, the biceps has two parts. One is the long head which originates in the shoulder, and one is the short head which is outside the shoulder. The part that is in the shoulder doesn't have a lot of role to play in your shoulder and elbow function, but it can be used as a good source of graft or collagen where the tissue quality of the rotator cuff is poor. So we can use the biceps to dynamically augment the rotator cuff, or what we can also do is we can take a portion of the biceps, we can flatten it out, which is known as a biceps smash, and use that as a thin sheet of collagen to augment the poor quality tissue of the rotator cuff. Both these techniques have shown good results, and typically we use them in situations where there is a big tear and tissue quality is a bit dicey. Now, the other techniques. So one is a synthetic graft. Essentially, it is made up of something similar to a hernia mesh like a polyester or polyurethane. We imbibe a PRP into this and then coat it over the rotator cuff so that accelerates the healing of the rotator cuff. It gives some amount of structural support. The next thing which we do nowadays is use a bioabsorbable patch. So it's a bioinductive patch. It allows for ingress of healing cells of fibroblasts which produce collagen and accelerate the rotator cuff recovery. So this is available under various brand names, but the moot principle being that it allows for ingress of cells which lead to faster healing of the rotator cuff and provide collagen support there. So this is something is that if we use in partial thickness tears of the rotator cuff, we can start with a very early mobility of the shoulder and help in a faster mobilization. In larger tears, it helps in healing. So guys, these are all the new techniques which are available nowadays by which we can accelerate the healing of your rotator cuff, give you a faster recovery and improved outcomes. So thanks for watching this video. If you like this, if you know somebody who is having a rotator cuff tear, do share it with them. Share, like and subscribe our channel. Keep watching.